A bit of good news from the weekend, but warning signs of more trouble if we are not careful. Don't let your guard down. So the good, no deaths from COVID-19 reported in Georgia today, a trend we've been monitoring now for weeks that started with a decline in hospitalizations. The bad, hospitalizations in Georgia are once again on the rise. That is a grim red flag. This data is being closely watched as more COVID variants pop up in the U.S., including a so-called double mutant. Should we be concerned about this particular variant? This is a developing story tonight, as Paula Soro explains. It's still too soon to tell.
It's called the double mutant variant because it carries two mutations on the part of the virus that attach to the cells, which means there's a chance it could be easier for the virus to latch on and be more transmissible.
Not worried about it. I'm ready to open up.
I've always listened to the scientists with this whole thing for about a year and 2 months now, and I trust them, and I know that they're concerned, so why shouldn't I be concerned as well?
First discovered in India, it's now made its way to the United States, the first case seen in California.
I think what raises concern is mutations occurring near or on the spike protein, which is the main area where the vaccines are active. So if you have changes to that area of the virus, there's a greater concern that it may impact on the ability of current vaccines to protect the public.
But public health expert Dr. Harry Hyman says it's still too soon to tell if this mutation will make vaccines less effective. That is still being studied. There are many variants being looked at on a daily basis, but the three that scientists have been most concerned about are the ones from the UK, South Africa, and Brazil. Dr. Hyman says so far this one hasn't been added to that list. In the meantime, Pfizer's CEO announced the company is developing booster shots so that their vaccine can protect against new, highly contagious variants.
Right now, I think there's more hype than there is content. We know that the longer this pandemic goes on, the more there will be new variants.
He says that in order for this pandemic to not drag on and for mutations to stop developing, people must continue to mask up, get the vaccine, and follow CDC guidelines.
The mask is nice, but it's getting old.
I think it's very important to try to curb the spread of it.